Okay, this video is called Anti-Aging Secret, Menstruation Jealousy. Okay, so what's this about? Well, first of all, this picture here, many years ago, I was working in private practice hospital. I was walking down the hallway with one of my male doctor friends, and there's this beautiful nurse in front of us with that hourglass shape, and I was thinking about asking her out. I said to my friend, you know what? I would gladly give half my salary to have her in my bed. And he looked at me and he said, Pete, she'd probably want a lot more than that. And it was obvious to me. I said, what an advantage she has. I have to give up half my salary to even think of her going out with me. I mean, why is the world designed this way? So anyways, what else about women gives them an advantage in health now we're going to talk about? Okay, let's see here. I got to go to here. Sorry, I just got to switch the slide here. All right, we're going to get to it. All right, so why do women live longer than men? Why is it that a premenopausal woman almost never has a heart attack, myocardial infarction? Okay, a couple things. People say, whoa, it's because of estrogen. No, it's not just because of estrogen, because if you just give people estrogen, it'll increase their coronary artery disease risk, myocardial infarction risk, prothrombotic. It's the menstruation. Menstruation lowers the hematocrit. That's the number of red blood cells in the blood, so it makes the blood less thick, lower viscosity. Lower viscosity makes it easier for the heart to pump the blood, so the blood pressure is lower. Lower blood pressure means less atherosclerosis. So she's got a lower hematocrit. Also, the red blood cells, a higher percentage of them are young in their age. That means a typical red blood cell lives about 120 days before it's removed by the spleen. With time, the red blood cells, with age, they get more stiff. Part of that's due to glycation. Part of it also is, I talked about this in my previous lecture on the effect of a high-fat meal on blood flow and whatnot. Less externalization of the type of phospholipid, phosphatidylserine, to the outer leaflet of the plasma membrane, moving from the inner to the outer leaflet of the plasma membrane. That also makes red blood cells more stiff. So the older red blood cells, and men have a higher percentage of them, are stiffer. That requires higher blood pressure to pump those through the arterial circuit. Okay, but there's a third thing not often thought about, and that women have a lower total body storage of iron, lower ferritin. And that means they have less oxidative stress. They have less iron that sort of escapes into what is called the free form of iron, labile iron pool, or we're going to refer to it here as NTBI. That's non-transferrin bound iron. Transferrin is the carrier protein in the blood, like a canoe that holds two iron molecules. Okay, so women have less free iron floating around, less tendency from iron-related oxidative stress. When iron's free, I'll talk about this in other lectures. I've given lectures on this before, but just trust me, it's a good thing to be lower in iron in this context. Okay, when I look at brain MRIs, women's brains in general look better than men. You look at a couple of 60-year-old brains, most of the men in the United States are going to have a couple periventricular small silent strokes. Flare hyperintensity is what we call them on an MRI report. So the female brains look a little bit better in general. Female spines look a little bit younger in general. I can kind of tell the age of a patient just by looking at their spine. The older the patients in general, in the ballpark sense, the more degenerative discs they're going to have. More disc space narrowing, dried out discs, that sort of thing. Desiccated discs. Okay, marginal osteophytes dish and all that stuff. So anyways, the female's brains are aging a little bit better and their spines are aging a little bit better. Menstruation stops typically around 50 years of age. Little sooner or later they become postmenopausal. They start getting fatter after that, okay, more prone to osteoporosis, and also their risk of heart attack goes up. They start accumulating iron. Their risk of cancer goes up. Their risk of stroke increases. Their risk of diabetes increases. And they start to age faster when you look at their CT and MRI. So what's my point? Well, they stop menstruating when they become postmenopausal. Well, maybe they don't have to stop. Maybe they don't. I got some friends who are like some of the best atherosclerosis researchers in the world. They donate blood every 4 months or so because they want to lower their hematocrit. They want to make their RBCs more deformable. They want to lower their total body ferritin and total body iron store. Okay? So what I'm saying is maybe they don't have to stop menstruating in a sense. If you think of menstruation as being a therapeutic phlebotomy, blood draw, blood removal, maybe they could take a small volume out every time they go for a pap smear, every time they go for a mammogram or whatever else, if they really need to go for that stuff. I'm not saying they do. But what I am saying is, one more thing too. I had a friend, a lady doctor, neuroradiologist, who did her residency in University of Illinois, where they rotated through Mercy Hospital, where they had They were centered right next to Chinatown, and they have all these old Chinese people who were eating a rice-based diet, and she said it was startling how great their brains looked. What a lack of atrophy they had from the rice-based diet, low-fat diet. But anyways, getting back to our brains here and our why women live longer and look younger, their brains and their spines up until menopause at least. And I've decided I'm going to announce my retirement from conventional medicine. I'm going to open up an anti-aging center. I'm just going to, the main thing will be blood draws. They'll do a whole bunch of other stuff there too. But no, I'm kidding. I'm not retiring right this moment at least. But why not do more therapeutic phlebotomies? And not just for the cardiovascular, but just for the overall improved aging. So anyways, this is still a topic of some debate, and I'll talk about it more in the future, but I thought that was interesting. I was kind of shocked talking with my partners about how these females looked younger inside than men did.